Right now, somewhere in the world, a person is lying in bed in a position that is silently putting enormous strain on their heart and blood circulation, and they have absolutely no idea. What's even more surprising is that something as simple as the way you sleep, something you do every single night, can either increase your risk of heart attacks, strokes, and dangerous blood clots, or significantly reduce those risks. Doctors rarely talk about this, but cardiologists and sleep specialists know that certain sleeping positions can dramatically affect blood flow, pressure on the heart, and even how your brain receives oxygen during the night. And the most shocking part is that millions of people are unknowingly sleeping in the worst possible position for their cardiovascular system. But today you're going to discover the sleeping position that may help support your heart, improve circulation, and even reduce the chances of strokes and thrombosis, and why very few people know about it. Let's start with something most people never think about. When you fall asleep, your body doesn't simply shut down. In fact, while you sleep, your heart continues to work non-stop, pumping blood through about 60,000 miles of blood vessels inside your body. Your brain continues to regulate breathing, blood pressure, and circulation. Your veins return blood back to the heart, and your arteries deliver oxygen-rich blood to every organ. But the position you sleep in can either help this system work smoothly or make it struggle all night long. For example, if you sleep in a position that compresses major blood vessels or puts pressure on your chest, the heart may have to pump harder to circulate blood properly. Over time, this can contribute to higher blood pressure, poor circulation, and even increase the risk of blood clots forming in the legs, a condition known as deep vein thrombosis. Now here's where things get interesting. Among all sleeping positions, medical experts often highlight one particular position that appears to support the cardiovascular system better than most others. That position is sleeping on your left side. At first that might sound like a small detail, but anatomically it actually makes a lot of sense. Your heart sits slightly to the left side of your chest, and when you lie on your left side, gravity can help support more efficient blood circulation through major vessels like the aorta and the inferior vena cava. This position may reduce pressure on the heart and improve how blood flows through the body during the night. For people who already have heart conditions, high blood pressure, or circulation problems, this small adjustment can make a noticeable difference. When you lie on your left side, the body is positioned in a way that allows the heart to pump blood with less resistance. Blood returning from the lower body can move more easily toward the heart, and the heart doesn't have to work as hard against gravity. Some cardiologists believe this position can slightly reduce the workload on the heart, especially during long hours of sleep. It may also help prevent the pooling of blood in the legs, which is one of the factors associated with clot formation. Blood clots are dangerous because if a clot travels through the bloodstream, it can block arteries in the lungs or brain, leading to life-threatening events like pulmonary embolism or stroke. Another important reason this position may be beneficial involves the brain. During sleep, the brain has a special cleaning system called the glymphatic system. This system helps remove metabolic waste and toxins that accumulate during the day. Some studies suggest that side sleeping, particularly left side sleeping, may improve this cleaning process compared to sleeping flat on the back. When the brain's waste removal works efficiently, it may reduce inflammation and support long-term neurological health. Since strokes are often linked to vascular and inflammatory problems in the brain, improving circulation and fluid movement overnight could be one small protective factor. But there's another hidden advantage that many people overlook. Sleeping on the left side may also help reduce acid reflux. This might seem unrelated to heart health, but reflux can trigger chest discomfort that mimics heart pain and can disrupt sleep repeatedly during the night. Poor sleep quality itself is strongly linked to cardiovascular disease. When you constantly wake up due to discomfort, your body releases stress hormones like cortisol and adrenaline, which can raise blood pressure and strain the heart over time. By reducing reflux and improving sleep continuity, left-side sleeping may indirectly protect your cardiovascular system. Now let's talk about one of the most dangerous sleeping habits that millions of people practice every night without realizing the risk. Sleeping flat on your back may seem comfortable, but for some individuals it can create several problems. In this position, gravity causes the tongue and soft tissues of the throat to fall backward, which can partially block the airway. This is one of the main reasons people develop sleep apnea, a condition where breathing repeatedly stops and starts during sleep. Sleep apnea dramatically increases the risk of high blood pressure, heart attacks, and strokes. Every time breathing stops, oxygen levels drop, and the heart has to work harder to compensate. Over years, this repeated stress can damage the cardiovascular system. Back sleeping may also allow blood to pool more easily in the lower extremities, especially for people who are sedentary during the day or who already have circulation issues. When blood flow slows down, the chances of clot formation increase. This is why doctors often recommend that people recovering from surgery or long flights keep their legs moving and avoid staying in one position for too long. The same principle applies during sleep. A position that encourages healthy circulation may help keep blood moving smoothly throughout the night. Sleeping on the stomach is another position that can cause problems, even though some people swear by it. When you sleep on your stomach, your neck must remain twisted to one side for hours. This unnatural alignment can strain the spine, compress nerves, and restrict blood flow to the brain and upper body. It can also put pressure on the chest, making it slightly harder to breathe deeply. Over time, poor breathing patterns during sleep can reduce oxygen delivery throughout the body, which is not ideal for heart and brain health. So if left-side sleeping appears to support the cardiovascular system, how can you train your body to adopt this position if you're not used to it? The first step is surprisingly simple. Use pillows strategically. Placing a pillow behind your back can prevent you from rolling onto your back during sleep. Another pillow between your knees can keep your spine aligned and make side sleeping more comfortable. Over time, your body will naturally begin to favor this position. Some people even use specially designed body pillows that gently encourage side sleeping throughout the night. Another helpful technique is adjusting your mattress and pillow height. If your pillow is too flat or too high, it can make side sleeping uncomfortable and cause neck strain. Ideally, your pillow should keep your head aligned with your spine, so that your neck remains neutral. When the spine is properly aligned, muscles relax more easily, and your body can stay in the side position without discomfort. It's also important to understand that sleep position is only one part of protecting your heart and preventing strokes or thrombosis. Lifestyle factors still play a huge role. Staying physically active during the day helps maintain healthy circulation and prevents blood from becoming sluggish. Drinking enough water keeps blood from becoming too thick, which can reduce clot risk. Maintaining a balanced diet rich in fruits, vegetables, healthy fats, and whole grains supports healthy arteries and blood vessels. And managing stress is equally important because chronic stress hormones can damage the cardiovascular system over time. There is another fascinating aspect of side sleeping that researchers are beginning to explore. Your lymphatic system, which helps remove waste and toxins from tissues, also works more efficiently when the body is positioned on its side. This system helps reduce inflammation and supports immune function. Since chronic inflammation is one of the underlying contributors to cardiovascular disease, anything that helps regulate inflammation during sleep may provide additional protection for the heart and blood vessels. Of course, there are exceptions. Some people with certain medical conditions may feel more comfortable sleeping on their right side or with their upper body slightly elevated. For example, people with severe heart failure sometimes find that sleeping completely flat increases breathlessness, so doctors may recommend raising the head of the bed. The most important thing is to find a position that allows you to breathe easily, maintain healthy circulation, and sleep deeply without frequent awakenings. The truth is that sleep is one of the most powerful forms of medicine your body has. During those 7 to 8 hours each night, your body repairs damaged cells, regulates hormones, stabilizes blood pressure, and resets your nervous system. But if your sleep position interferes with circulation, breathing, or spinal alignment, your body cannot perform these healing processes efficiently. That's why something as simple as adjusting how you sleep can sometimes have surprisingly meaningful health benefits over the long term. So tonight, when you lie down in bed, take a moment to think about your sleeping position. A small adjustment, turning onto your left side, supporting your body with pillows, and allowing your spine to align naturally, might quietly support your heart, improve circulation, and reduce stress on your cardiovascular system throughout the night. It's not a miracle cure, but it's a simple habit that works with your body's natural anatomy instead of against it. In the end, protecting your heart doesn't always require complicated treatments or expensive medications. Sometimes it begins with small daily habits that most people overlook, like the way you sleep. And when those small habits are practiced consistently night after night, year after year, they can make a meaningful difference in your long-term health. So remember this simple idea: your sleeping position matters more than you think. Sleeping on your left side may help support healthy circulation, reduce strain on the heart, and improve breathing during sleep. Avoid positions that compress the chest, strain the neck, or disrupt airflow, and focus on creating a comfortable sleep environment that allows your body to rest deeply and recover fully. If you found this information valuable, make sure to subscribe to the channel, like this video, and let me know in the comments what health topic you would like to learn about next. Your support helps us continue bringing simple, science-based tips that can make a real difference in everyday health.